straight biter, yeah. Okay, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment here. I'm sorry, the lateral compartment here. I'm waiting for another little instrument to have a better look in the medial side. And you can see this tear in the meniscus on the lateral side. Okay, we're right at the popliteal hiatus, and you can see this free edge that's torn here. And so the other thing that's remarkable here is you've got a fair amount of cartilage loss, which is kind of synonymous with saying you have a fair amount of arthritis on this side. You can see there's areas up above where there's complete loss of cartilage. And so that part we can't fix today, but hopefully the PRP injection will help with those symptoms. I don't want to take any more of this meniscus than I have to. All right, so I think we're just about done on this side. We are going to put in the shaver because it has suction attached to it. Okay, so we got our stitch in right where the MRI scan showed us, about a centimeter behind the midpoint of the body, and that ought to hold that down and give that a chance to heal. Now the next step is to take our spinal needle and our PRP, and we're going to inject that in a very similar location. See, here's the needle. I'm going to basically put this back here. I'm trying to stay away from the stitch, obviously, but still get it at the meniscocapsular junction. We don't need to turn off the water yet because this will be in soft tissue. You can see the meniscus kind of plump up there as we do it. Okay, and then once we max out, we'll turn off the water, drain the knee, and it's going to get hard to see in a minute, but what we'll do is we'll back out the needle, and the rest of this PRP is going to go in here once we drain the knee out, which is what we're doing right now. Okay, so that's where the rest of the PRP is going. I'll show you what it looks like just for a second. That's what it looks like. You can't really see much but a little bit of yellow fluid, but let's go ahead and put the suction on there, and we're going to finish up here and get you back to the recovery room. Good luck to you now. Bye-bye. Okay, so this is your patella at the top of the screen. Unfortunately, there's not a lot of arthritis here. You've got some cartilage issues in the trochlea. See this loose piece here. And so we don't want to leave that. That would probably become a loose floating piece of cartilage if we just leave it. Okay, so we look up in this area in the suprapatellar pouch. I don't see any significant issues here so far. That looks pretty clear. So we'll keep looking. We're going to finally go back and look in the medial compartment where we started here.